Hi, this is Terry QT with Deep Sea Foundation. I have the honor of sitting with Oncoplastic breast surgeon Dr. Patricia Clark today from Ironwood Cancer Centers in Phoenix, Arizona. Welcome, Dr. Clark.
Thank you.
Yeah.
Thank you for letting me be here.
Absolutely. It's good to have you today. So, I want to set up a scenario with you that I am a breast cancer patient who's just come into your office with early stage breast cancer. And now, after my diagnosis, I'm wondering what my next steps are. Surgical options, treatment plans. What do I do?
Okay. So when you first come into my office, I need a little information from you. Your surgical treatment is generally going to break down just two ways. One is lumpectomy with radiation.
Okay.
The other is mastectomy without radiation. And then there are quite a few factors that a patient is going to consider to make that choice. One of the first things you need to know is the recurrence risk between patients who get lumpectomies with radiation and mastectomies are probably only a couple percentage points different. So the mastectomy, post-mastectomy patients have almost the same risk of getting a recurrence in that breast as somebody who had a lumpectomy. And the difference there is because of the radiation. The lumpectomy gets radiation, almost the whole breast gets radiated. The mastectomy patients, if it's under 5 centimeters and not in the lymph nodes, they don't get radiation.
Okay.
So some people will choose a mastectomy just to avoid radiation. With the mastectomy patients, if it does recur, it comes back in the skin flaps, it comes back in the scar, it comes back in the chest wall. So that's not a reason to choose breast conservation over mastectomy. Recurrence, not much difference. The second thing that we think about is people don't want to get another cancer. The average risk woman has a 0.1 to 0.6% chance per year of developing, say, a cancer in the opposite breast that's not related to this first one. So if they're going to live 30 more years after the breast cancer diagnosis, they probably have a less than 15% chance they will ever have another cancer.
Okay.
So that's a number, most people overestimate that. Now, when I'm looking at lumpectomy versus mastectomy, there are several things that we want to consider. Family history. Does the patient have a strong family history of breast cancer? Do they have a pathologic genetic mutation like a BRCA? Those patients would benefit from mastectomy just to prevent that second cancer. Okay. Somebody that's having breast biopsies every year, their mammograms are just constantly abnormal, they're done. That's a reasonable reason to choose mastectomy. With the lumpectomies, we look if somebody's tumor to breast ratio is favorable, and we can remove that tumor without deforming the breast, they would be a candidate for a lumpectomy.
Okay.
It used to be somebody who had more than one tumor in a breast. Those patients all got mastectomies. With oncoplastic techniques, we can combine breast reductions and breast lifts, and we can take out large amounts of disease from the breast. As long as we get it all out, we can conserve the breast.
Okay.
So then that becomes a patient preference. I personally have a bias. If I have a patient who has disease in their axillary nodes, and I know that they're going to get post-mastectomy radiation, I would prefer that they got the lumpectomy and we just radiated their own natural tissues, because I think they're going to have fewer complications with radiation of their own breast tissue than they will with an implant that they may have during a implant-based reconstruction, or even autologous reconstruction. The autologous reconstruction, if we're going to do that, say take abdominal tissue and move it up in a deep flap, if we know somebody's going to get radiation, in my patients, I have my plastic surgeon put a tissue expander in. We radiate the tissue expander, and then when they're all done, then we move the healthy tissue from the abdomen up. But
so radiation prior to all of this.
Radiation.
Yeah.
So I think the important thing to know, if you're trying to choose between lumpectomy versus mastectomy, family history, family history. Have you had a lot of biopsies? Do you have a genetic mutation? Those are kind of the big factors. Chemotherapy, unaffected by your surgical choice, because chemotherapy is targeting any cells that have escaped the breast and they're residing somewhere else in your body, like the bones, the lungs, the liver. If you think about it, whatever I do with your breast is not going to make a difference. If you're going to metastasize, it already happened before I remove the breast tissue.
Yeah.
So that shouldn't factor into lumpectomy, mastectomy. And interestingly, the other thing it shouldn't factor in is unfavorable tumors like triple negative, HER2 positive. Those are very unfavorable. They're very deadly tumors. Fortunately, we do very well with them with modern chemotherapy, but there is no survival advantage to doing a mastectomy with those tumors versus lumpectomy. In fact, with the HER2 positive tumors, those are the least likely to come back after we've treated them. So those patients do very well with breast conservation.
So I think the key word that hits me, as a patient who's had breast cancer twice, is that word recurrence. So you hit on that at the very beginning and explained it well. So thank you very much for that.
You're welcome.
All right.
You're welcome.